Hey guys, welcome back, and in today's video I'll be taking a deeper dive into the Affordable Care Act, also known as Obamacare. We'll explore exactly what the ACA is, how it functions, and how you could potentially be eligible for some of its benefits. So if you're curious about the Affordable Care Act and its impact on the healthcare system at large, then this video is going to be for you. And remember, everyone's eligible to get a free consultation. If you're interested, you can find the number on the screen or in the description down below. To begin with, the Affordable Care Act, commonly known as Obamacare or simply the ACA, is a comprehensive healthcare reform law that was passed in the United States back in 2010. Its primary goal was to make healthcare more affordable and accessible to everyone. To achieve this, the ACA introduced a multitude of reforms across the healthcare system. Reforms such as new regulations for insurance companies, expansion of Medicaid, and the establishment of the health insurance marketplace. This marketplace acts as sort of a hub where individuals can shop and compare different insurance plans based on various factors such as cost, coverage, and more. You might be thinking, can I get health insurance outside of the ACA marketplace? And the answer is, of course you can. But doing so means you might miss out on some significant perks and benefits. And one key advantage of getting insurance through the Obamacare is that you may be eligible for financial aid that can reduce your monthly premiums and out-of-pocket expenses. This aid comes in the form of subsidies, which can be hugely beneficial, especially considering the rising costs of living. You're for sure aware that everything is going up, from rent and the price of gas, and even the cost of groceries like meat and eggs. Everything has gone up. Consequently, many people have decided against getting insurance because they're just barely making ends meet, living paycheck to paycheck, and the last thing they want to worry about is another monthly bill. However, the Affordable Care Act was designed with these scenarios in mind, as it aims to help people get insurance without burdening them with high monthly payments. Based on your income, you might qualify for free or low-cost silver plans through the ACA subsidies. This implies that the government would cover most, if not all, of your insurance costs. And if you're wondering what silver plans are, insurance plans usually come in 4 tiers, with silver plans falling somewhere in the middle. They can cover about 70% of your healthcare costs and usually have very low deductibles. Also, it's essential to know that this assistance isn't exclusive to low-income households. Even individuals or families with medium incomes might qualify for the ACA subsidies. And if you want to know more about the benefits you might qualify for, don't hesitate to call the number on the screen or in the description down below. ACA plans are required to meet specific standards and follow certain rules. For instance, all ACA plans must provide clear and easy to understand plan information and the ability to appeal insurance decisions. Moreover, if you're a parent, you can keep your children under your insurance plan until they reach 26. Insurers on the marketplace must also have a network of quality healthcare providers, giving you a range of choices. And even if your preferred doctor or hospital isn't in the plan's network, you may still be able to see them at a slightly higher cost. And another significant aspect of the ACA is that it guarantees you won't be denied coverage or charged higher premiums for any pre-existing conditions you might have, like cancer or diabetes. This is a marked contrast to the non-ACA plans, which might reject your enrollment altogether in most of these cases and charge you a lot more for this type of thing. In addition to that, the ACA plans are required to cover essential health benefits such as preventative care, hospitalizations, prescription drugs, and mental health services. They also reduce the financial burden for expectant mothers by covering pregnancy-related care. Having these essentials covered by your plan could save you a significant amount of money in the long run and allow you to focus more on paying other bills rather than worrying about emergency checkups and expensive medication. So if you want to learn more about these essential benefits and other perks you may be eligible for, feel free to call the number on the screen. Even if you consider yourself a healthy person, having health insurance is still a good idea, as it allows you to receive preventative care like checkups and screenings, which can help catch any health issues early on. Also, should you ever face a medical emergency, God forbid, having health insurance can help cover the cost, reducing your financial burden. For those of you currently holding non-ACA insurance, it might be worth considering switching to an ACA plan. By doing so, you could potentially save more money, as the marketplace makes it easier to compare different plans and choose the one that best suits your financial situation. Plus, you might be eligible for financial assistance if you meet certain requirements. Being covered by Obamacare also offers broader coverage for essential health services like preventative care, maternity, mental health, and substance abuse assistance that you'd otherwise pay more to get with non-ACA plans, since they don't usually cover these in most cases. In summary, the Affordable Care Act and its marketplace have made healthcare more comprehensive and accessible to a lot of people. With its consumer protection rules, getting an ACA insurance plan might be the best option for almost anyone. So if you're curious about the benefits you may be eligible for, I highly recommend that you take advantage of your free consultation by calling the number on the screen or in the description down below. But the ACA isn't the only way you can save money on healthcare. If you're self-employed, for instance, you could save thousands on your healthcare expenses. ACA family health insurance can start as low as $10 a month, leaving more money in your pocket for other expenses. Furthermore, if your annual income is less than $50,000, you could be eligible for a health insurance plan worth up to $1,400 per month. And remember, the Affordable Care Act isn't just about health insurance. You could qualify for up to $1,600 per month in health subsidies if you earn less than $100,000 per year. This subsidy could help you cover the cost of prescription drugs, doctor's visits, and preventative care, and more. In addition to these health-related subsidies, you could also apply for rent and housing assistance to help you pay rent or utilities in 2023. You must meet certain requirements to qualify for this assistance, such as having U.S. citizenship, meeting the annual gross income requirements, and qualifying as a senior or a person with a disability. And for those of you on Medicare, SNAP, EBT, or if you have a low income, there's another benefit that you should be aware of. You could get a free smartphone with unlimited minutes, text, and data. This phone comes with 25 gigs of high-speed data, all at no annual cost to you, and with no contract or any activation fees. That's a lot of information, I know, but remember, these are opportunities for you to get the help and support you need without overstretching your budget. Whether it's getting affordable health insurance, receiving a subsidy to help with medical expenses, saving on your phone bill, or getting assistance with housing costs, these benefits are designed to ease your financial strain. So that's going to be it for today's video. Feel free to comment below if you have any questions, and don't forget to hit the like and subscribe button if this video was helpful to you, or if you'd like to stay up to date with future videos. Guys, thanks so much for watching, and I'll see you in the next video.